So we're gonna be taking staples out.
Yes, sir.
Yeah.
I don't want to.
So, well, I don't mind looking.
No, you don't.
It's the feeling part that kind of sucks a little bit, but
Yeah.
my experience from this before is that it feels a lot like a little bee sting or a wasp sting. The good ones feel like a bee sting. The bad ones feel like a wasp sting, and it only lasts for about as long as it takes to say the word wasp sting. So, you know, one of those deals. And that one felt more like a fire ant, which I would say is less than a bee sting.
I feel like this can be a little more tender.
Yeah, and see, I haven't had a pain pill since midnight, which I should have thought about that.
Yeah.
Yeah.
Not good.
Yeah, those sting quite a bit. Bleeding some?
Yeah, but and that's normal.
Well, we're supposed to try to keep the blood inside.
Right. But you're on a blood thinner.
Huh?
You're on a blood thinner.
Just baby aspirin.
That still thins your blood.
Ooh, wow, that one shot all the way down
Breathe.
halfway through my calf. No, it did. It shot like a tingling.
Yeah.
Went all the way to my calf. That one hurt. Got to bring the sweat rag. Ooh.
You may get you a cold towel, paper towel.
I might need a towel when I'm done here.
You want one
Just
now?
to, no, it's okay.
Okay.
It's just enough to make me break out in the sweat.
Don't press on me, please.
I'm not gonna pass out on you. Just
It happens.
All right.
making me sweat.
It's like the yellow brick road of Staples.
Yeah, I can't remember how many they said there were.
42.
42.
Well, I'm glad he counted because I can't count and concentrate like at the same time.
Yeah. Well, we don't need you to do that.
Right.
Oh, that was another one that sent a shock up and down. Hit a nerve. Oh man, seems like you've been doing this forever. Seems like
Oh,
you still
yeah.
got a long way to go.
I'm so sorry. Almost done.
I know.
Almost done.
All right, we got to do anything to it now?
I'm gonna put these fairy strips on it.
Just to keep stuff off of it, or
You can take a shower now without covering your knee.
okay.
You'll just want to make sure it's nice and clean and dry.
Yeah, they told me before, don't take a shower, just you do sponge baths.
Yes. I'm so glad you read your post-op instructions.
I didn't. I just
Oh,
somebody told me that. I just remembered it.
Why do I do things if you're not gonna read them?
Well, I was on drugs in my defense. It's like I recorded Dr. Ojard when he came in to talk to me after the surgery. I said, do you mind if I record this? I said, because I go into my colonoscopy doc and he does a colonoscopy and then comes out and tells me all about it. And
And you're
2 days later, I had no idea what he said because I was coming out of anesthesia,
Yeah.
you know. And Dr. Ojard was like, yeah, no, I understand. So, but, you know, I think I'm going to remember it, but 2 days
Yeah,
later, then I'm
he's
like,
still-
I can't remember.
It's still fog, like it's super foggy. I had surgery and I was like, I can't remember if that really happened or if I'm making that up.
So, are these things just going to fall off on their own, or
Yes.
do I need to take them off every certain amount of time?
They will come off on their own. I wonder if that's from like the adhesive from like the wound vac or
That's
something.
Yeah, because there was I had another little blister down. I think it was, I'm sorry, it was right here. This right here blistered up. And it was just, you just able to wipe the skin away with your finger, and then it was just clear plasma leaking out, oozing out of it underneath that. And this was the same way.
That's crazy.
So